to the debate.
Diolch, Deputy Llawydd, and I want to start this by thanking everybody in this chamber who has contributed to this very important debate today. This debate is of vital importance to the people of Wales, and I know personally about this waiting list, as my mother has been waiting 4 years for a hip operation, excruciating pain, but I'm pleased to say that she has now been treated. My colleague Russell George, Rhys Yorwerth, Janet Finn-Saunders and others had said, NHS waiting lists now are longer than ever before. 1 in 5 people are on a waiting list. This affects people of all ages and all backgrounds, and they're all being hugely negatively affected by these backlogs. As Rhys said, the NHS was creaking under pressure before the pandemic began. Early delays, which was mentioned, have caused problems in the wider NHS, and it has made pre-existing health conditions an awful lot worse, especially around cancer diagnosis. I was very pleased to see more investment going into the NHS. However, we do need to be assured that additional investment will be spent on the frontline NHS and not lost in bureaucracy. We don't need any more managers. What we need is more doctors, nurses and frontline health professionals to deal with the problem. More money goes into the NHS in Wales than in England. So it's not the money that's the problem, it's the way that the NHS is managed. It was great to hear Altaf Hussein's very powerful contribution to this debate, and I'm sure everybody in this chamber knows of your experience, Altaf, and you're very well respected, not here, but across the world for your experience in the NHS and what you have done. In my own constituency, residents face lengthy delay times. They don't have access generally to a general district general hospital. We are seeing community support being reduced. Knighton Hospital in my community has seen the services cut back. We're seeing local wards closed. Janet Finn-Saunders made the point about local community help, and if we are to sort the delayed transfers of care out, we need to make sure there are beds in our community hospitals for people to be transferred into. We have previously discussed the damning report Waiting Well, which stated the impact of waiting time backlogs. It called for robust plans to be put in place. Whilst the Minister has announced a series of measures to tackle this, I and many others welcome that statement and the commitments in place. But it's vitally important that the Government and this Senate and relevant committees can scrutinise health boards to make sure they are delivering on their targets and that people aren't let off the hook. Jenny Rathbone did say that this plan's only been in place for 2 weeks. But I would just like to remind you that this government's been in place for over 20+ years, and it was creaking before, so you cannot blame the pandemic for everything. Things were going backwards before, so I'd like to ask the Minister to reflect on that and not blame everything on the pandemic. Yes, Jenny, I'll take an intervention.
Yes, it's only been there for 2 weeks. So what is it that's not adequate about this plan? You say it's not an adequate plan, so what would make it adequate in your view?
What we want to see is timescales. We're not seeing adequate timescales for delivery on these things. We're seeing the surgical hubs, some of those don't have. We're not seeing when surgical hubs are going to be delivered right away across Wales. There's no time frame for that. It's in the plan. We're not seeing where all this money is actually going to be invested. We want to see that so we can scrutinise it properly, because we do welcome surgical hubs. Minister, that's something that you and I and you and Russell George and I party have been calling on for many years, because we want to see numbers of people going into the NHS increasing. But when those people go in, we need to make sure there's adequate staff there to make sure those people are getting seen. And I've said to you, and I'll say it again, I do think we need to have a radical look of how we get people into the NHS, whether that's through degree apprenticeships or having a radical overhaul of how people become nurses or doctors. A lot of people have mentioned in this chamber, I'll make a bit of progress, Carolyn, I will come back to you, that prevention is better than cure. Many people have said that, and I do respect the Deputy Minister's position here of trying to address that, but we need to push this faster, quicker, to make sure it's delivered. We don't want to see people who are suffering with obesity on waiting lists, because that puts pressure on the NHS for getting delayed in discharge. Public health needs to be prioritised, and that's closer integration with our local authorities. I do want to talk about discharge. Social care and the health sector working together isn't working at the moment. We have seen too many people sat in hospitals bed blocking, and the link between the health boards and our councils needs to be more integrated. And I know, Minister, you will say that we now have the regional partnership boards in place to help deliver that, but 1,000 people still waiting in beds, as Russell George has said. I'm not sure if that integration is working, and that's something I'd like to push you on, is to make sure the regional partnership boards are delivering that. Minister, I don't want you to see this motion as an attack, and I think the emotions got very high earlier around this. Russell George, my colleague, put in some very good points of how we would like to see things improved across Wales. And that's what I want us to do here. The NHS isn't Labour's, it's not the Conservatives, it's not Plaid, it's not the Liberal Democrats. It's the public's NHS. They pay their taxes, they expect a decent service. And that's why we as Welsh Conservatives will hold the government to account on this. That is what we are here for, and that is why I urge all members to support this motion in front of you today.